Well, we're certainly starting to enjoy the warmer weather. There's a serious health threat to those who like to spend time outdoors. Lyme disease affects more than 20,000 Americans each year. And some patients say they suffer from a chronic form of the disease that is resistant to antibiotic treatment. Right now, Lyme disease victims from around the U.S. are protesting, calling for new guidelines to improve treatment of the disease. Well, joining us now, Bruce Fries, a Lyme disease patient who joins us now with more on all of this. Bruce, thank you so much for being with us today. Certainly, a lot of people know what it's like to live with Lyme disease and that the symptoms can last days, weeks, months, or even years. You yourself have been living with it. How are you feeling now?
Well, I'm feeling great right now. I'm fortunate to be in remission. I've had Lyme and various co-infections for 7 years, and I'm one of the lucky ones. A lot of people have lost their jobs and lost their homes, so I'm very lucky to be in remission. But if I stop taking the antibiotics, it creeps back, and I don't want to take antibiotics, but that's the only option for me right now.
A lot of people are unaware of what happens to someone when they are diagnosed with this. Describe day to day what it feels like.
Well, the hardest part is everything's so new. You have these symptoms that might be flu-like or it might be like arthritis. And then once you start going to your physician, doctors are woefully uneducated about Lyme disease. So a typical Lyme patient might see 10 to 20 different doctors before they find one that's willing to treat them. And by then, it's progressed so far that it can become chronic, which means that it resists standard treatment.
You said that's sort of what happened with you. It started in your knee was swollen, and you thought to go to a doctor, but not to think that perhaps that's what this could be, not knowing what it was to begin with, and that you didn't receive the proper treatment that you needed for it for quite some time.
Exactly. My knee was swollen. I was on physical therapy and crutches. If my doctor had up-to-date guidelines, I could have avoided 7 years of severe fatigue, odd aches and pains, and functioning at a fraction of my normal level. I could have avoided thousands of dollars in lost income and out-of-pocket cost. It's different for everybody. Many cases of Lyme are misdiagnosed as fibromyalgia, chronic fatigue, depression, or other psychiatric illnesses.
And the issue is that a lot of people don't know or aren't aware of exactly what this could be or what they need in terms of treatment to be able to feel better. And you're going to be busy over the next 2 days with the 2014 Mayday project. This is going to be the shirts that you all will have here for the 2-day event. And throughout on the website, it says that more investigation needs to be done for this, that you all need better guidelines. Talk about what you hope to accomplish over these next 2 days. Okay,
the fundamental issue we have, and we're not mad at the IDSA and IDSA members. There's a lot of great doctors. They do a lot of great things. It's specifically with the guidelines for Lyme that haven't been updated significantly since 2006, despite the science has progressed a long way. Now, the reason why this is so important is that treatment guidelines are used by insurance companies to determine what to cover, and they're also used by physicians to guide how they diagnose and treat people. So with these out-of-date guidelines, people are denied treatment because the physicians have bad information, and if they can get treatment, they have to pay out of pocket. And it's typically $20,000 or more. That's a terrible cost to somebody who's chronically ill, and then you have that huge financial burden on top of it.
If you'd like to join in on the conversation, give us a call on the News Talk line, 703-387-1020. We'd like to know more about the Mayday project going on over the next 2 days as well. Certainly, a lot of people think that there's either a lack of awareness with the disease or a lack of knowledge. Do you think it's a bit of both?
Well, it's a combination of both. Similar thing happened when AIDS came out like in the early 80s. It took the medical community a while to understand it. There was a lot of resistance to putting research into it. And Lyme is in the same situation. And actually the number of cases is much higher because the CDC recently did a study and they realized that 90% of the cases are underreported. So the actual number is more than 300,000 people a year and could be as much as 600,000. That's a lot of people. And the doctors who treat these patients are persecuted and subject to medical board investigations.
A lot of people say that, I go out in the summertime and I'm out in the woods and I try to be careful about ticks and things like that. And, I didn't realize, what should people be looking for in terms of if they feel like there might be a possibility that something could have happened, that they could have gotten a tick bite that could lead to this? Because certainly some people aren't aware of what they should be looking for in that case.
Well, the number one thing to know is most people do not see the tick because the baby ticks carry the worst diseases and they are smaller than a poppy seed. So if you have flu-like symptoms without congestion, that's possibly Lyme. If you have joint pains that move around, now the key is prevention because you're not going to know the tick has bit you. So there's a product called permethrin. You spray it on your clothes and on your boots. It kills ticks and doesn't harm humans.
That's a great thing to know, certainly as we head into these warmer summer months and people are out and about. Having this Mayday project this year and having these 2 days, when you talk about the guidelines specifically, what would be successful for you in terms of moving forward and changing the guidelines that would make it easier for people like you or people who recently have found out that they have Lyme in terms of treatment moving forward?
Really, all that's needed is for the guidelines to reflect the principles of evidence-based medicine. And it's pretty straightforward. The truth eventually comes out. Sometimes there's disagreements. So you have two camps. You have ILADS, who believes that Lyme disease is a serious epidemic. And then IDSA, they think it's simple and easily treated. So there's a divide in the medical community.
Competing forces back and forth.
Now, IDSA has been accused of just looking at their own evidence, and I don't know the details, but let's look at all the evidence. Let's bring it out and update the guidelines to reflect current science. That's all we want.
As someone who's been living with this, how frustrating has this process been to get the attention, the awareness, and the change?
It's been terribly frustrating. And another thing that's been frustrating is some of these organizations actually work to block patient-sponsored legislation. So we think the patients should be put first as customers, but for example, the IDSA at one of their annual meetings passed a resolution that said defeat patient-sponsored legislation. And to me, that's wrong. It should be the other way. You should work for patients, not against your patients.
Speaking of patients, certainly a lot of people who are currently living with this will be at this event over the next 2 days. Describe what those conversations are like amongst each other to be able to try and find the best result for each one of you.
Well, we share a lot of information because there's a lot to be learned. Antibiotics help some, but they aren't the answer. So a lot of people we talk to tell us about things that they've done, natural treatments, herbal treatments that allow you to not depend on antibiotics, which can be very harsh for a lot of people.
In terms of being able to work with them and being able to still lead their everyday lives?
Oh yeah, and sometimes antibiotics affect your digestive, and a lot of people have to go with IV, which is pretty intrusive. You get a PICC line. So it's a very complex disease, and what has happened is you have this sort of divide in the medical community where a small group of influential researchers and physicians have put their conflicts of interest and their own academic priorities ahead of the patients. And we don't care about that. We just want we want our health. We want them to put our health first.
And certainly with people talking about 20,000 people that are diagnosed with this, why do you think it doesn't receive more attention? Why do you think more people aren't talking about even trying to find a cure?
Two things. There's a lot of diseases out there. So Lyme is one of many, and it's a very complex disease. It's been around a long time, but it can mimic so many other diseases.
And are there other things that can compound it as well once you have Lyme, the other things that can certainly complicate matters?
Yes, Lyme is usually just one of many infections you can get from a tick. I had several co-infections, babesiosis, Bartonella, and Lyme. And doctors are used to just looking for one cause of one disease. They're faced with this complex thing, multiple infectious agents. And it just takes a while, but people are suffering while they're figuring it out. That's why the people are at Mayday.
Take us back to those things of why you think it doesn't receive so much attention. Obviously, there are a number of diseases that the medical community is constantly looking at and testing and doing trials for. But what else do you think contributes to the fact that we really don't hear a lot about research being done or the guidelines or even those who are suffering with Lyme every day?
Yeah, it's a good point about research. Lyme disease is faster and has more annual cases than AIDS, swine flu, West Nile virus combined. If you compare research money for Lyme to AIDS, it gets 1/2000th as much money per new case on an annual basis. Now, they're both serious diseases, but $25 million for Lyme and $3 billion for AIDS. Lyme should certainly get a larger share.
And moving forward after this weekend, what do you hope the takeaway is for not only you all who are living with this disease, but also the medical community? If there's one thing that people can take away of this Mayday project, what do you hope that is?
Well, Lyme disease is a serious epidemic of epic proportions, and we really need to mobilize and start working with our doctors. We need Congress to get involved. There's legislation currently pending before Congress that's sort of, just set in a standstill, so that's a good start.
All right, action on the Hill, sometimes a little harder to get than many people would like to see.
Yeah.
If you'd like more information, head to the maydayproject.org. And Bruce Rice, thank you so much for coming in. Best of luck this weekend. We are back with more News Talk coming up in a moment.